Hey, my name is Eugene Thoman, and I want to share my experience shadowing Dr. Penepent in his private practice. So, Dr. Penepent sees many patients. He's pretty much well, not just but a general practitioner of internal medicine, and he probably sees, face time 15 to 20 minutes with each of his patients. Now, one that really stood out to me, well, there's two, but one that really stood out to me was this mentally handicapped, retarded guy with tons of psychological problems. And, the reason why he was seeing Dr. Penepent as his primary doctor, who managed this list of medications, was that he didn't trust the psychiatrist. So, if he didn't, because, mind you, now this gets into something a little deeper, you can't force anyone to do what they don't want to do. So if they don't want to go see their psychiatrist, he's not going to go find another psychiatrist. It's very important to manage this individual's medication some way or another. Dr. Penepent also made the comment that this guy's like his son. He's been with him for as long as his kid's been around. So they've grown to have a really close relationship where Dr. Penepent knows this man's life very well. So he's coming in and he wants to get treated for his leg swelling, his edema, because of his heart conditions and diabetes. I mean, that's what I'm inferring based on my physiological and pathology knowledge of the human body. So, his life is just very odd compared to what we're all used to. I mean, drinking liters of soda is not normal to me. I mean, I drink probably about 4 liters of water a day and don't drink really anything else. But for some people, they drink a lot of soda, and we know that's bad for them. I mean, what this really taught me is not only that you have to be very compassionate. It's not you have to be. You are compassionate. I mean, I'm a loving human being. But also that you need to analyze people's lives. I mean, this individual was on a list of medications. He was drinking tons of soda every day. So not only do you have this chemical interference with the pharmacology of drugs, but you also have the chemicals that he's ingesting in his diet. With the high soda content, I mean, obviously the normal answer is reduce soda intake to increase well-being, or, that's not really scientifically proven, but you can infer this. That would be the most logical reason. Another thing that I want to point out too, which is kind of off topic, but it's more of the pharmacist's job, is you have to read scientific literature, and then in this case what I just thought of is if you read all the literature on how the drugs interact, you still need to use your personal experiences to suggest something to the patient that they can do to better themselves. So I learned a lot from that experience. There was another experience, and it's assurance. I want to quickly just say that this man had headaches. We don't want to freak him out that he's having a brain tumor, because we know that your mental state affects your physical state, and said to him, prescribe the CAT scan. So, that was assurance that everything's okay, but we're just going to check it out. That was very important to see that early on, because it shows that how you can handle patients in a way that is not threatening. It's, you're doing what you can. So it's very important for that. And the last thing was the 4 A's of success. It's affordability, affability, availability, and ability. I'm going to leave that at that. Have a good night, everyone.